Tony, let's find out what the lockdown looks like there. We have Mawande Kheswa on the streets for us this morning. Mawande, a very good morning to you. And yeah, we've seen what's happening in Alex. Lots of concern as Tony was chatting there to Zikona. Viewers saying, you know, why aren't people practicing social distancing? What is going on? What are you seeing in Durban?
Good morning, Yuveka. So as far as Durban is concerned, we started off in Warwick Avenue, a place commonly known as eNCA. That is where we've got quite a number of taxi ranks and people disembark or they descend onto that area to take various transportation modes as far as taxis are concerned. So there were taxis there and there were a lot of health workers there. There were a lot of security workers there heading on to work, as those are part of those that are essential. We've shifted our focus since and looked at the issue around homeless people, and that is where I'm going to take the conversation now to Raymond Perrier from the Dennis Hurley Center. We thank you for your time. Now, people at home have been asking themselves, what is going to happen to the people that are destitute, and those are the homeless? Could you take us through what is transpiring here behind you?
Of course, yes. So in a lockdown, if people are locked in their homes, where do you get locked down if you don't have a home? It was wonderful that the President made a specific mention in his speech on Monday about providing an emergency shelter for homeless people around the country. Here I am in Durban, and we've been working, NGOs, working with municipal officials under the fantastic guidance of the Deputy Mayor, Belinda Scott, and we have created a response to an emergency shelter. So here we are, behind me, you've got about 600-700 homeless people. We're expecting 1,000 today, and they're all going to be processed here at the Durban Exhibition Centre. That means they'll have an interview with the social worker, we'll do health screening so that we can check if anyone is showing symptoms, and then they will be allocated from here to 7 different locations around the city. So they won't be staying at the exhibition centre. Unfortunately, it would have been really nice if people could have stayed here, but that wasn't possible. But they will be allocated to shelters around the city. Some are tents in parks, some are buildings, and each one takes 100 people. So in those locations with 100 people, they will be locked down for the 21 days. They'll get food there, they'll get nurses coming to see them every day, and they'll be safe and they'll be protected.
As far as your knowledge is concerned, water and sanitation, will that also be provided? Because temporarily I did see quite a number of tents in and around the city. But one of the issues that I noticed was that they had to urinate on the grass and so forth, and there was no proper water and sanitation. Where are we with that?
Yeah, you're quite right. So we're effectively 24 hours behind where we should be. We tried to get this done, but honestly there are some forces in the city which don't go at the speed they need to. Tents were set up last night. Showers and ablution facilities and toilets will be set up today. So by the time people go to a site, there will at least be cover, toilets and showers. And food. The food system has been set up. Food is fantastic. We have NGOs who are who are really working hard to provide food. We've got breakfast, lunch and supper organised for 21 days for 1,000 people. It'll be more if we end up with more people.
So crowd control will be something that is important. What will be the situation around security? Will there be people monitoring? Because, I mean, it's quite easy for people to get frustrated being cooped up in one space with other people for 21 days.
Yeah, absolutely. So each site will have a manager. I'm managing one of the sites, for example, down by the beachfront. There'll be a manager 24 hours a day, so we'll have a rotation, and there'll be 4 security at each base. You've got 100 people, 4 security, but also we'll create teams within the groups. There are natural leaders within the homeless community. We work with them every day, so we know a lot of these guys, and we'll identify who the natural leaders are, encourage them to work in small groups. But here's the amazing thing. We have a chance to do work with homeless people for 21 days because they've got nowhere to go. So we've got rehab opportunities. We've got chances for people to talk about their lives, to talk about how they can turn their lives around. This is a really positive opportunity to transform people. So at the end of the 21 days, we want them not just well, but we want them positive and confident and active citizens.
Now, in closing, humanity is going to play a huge part and a huge role in terms of how we overcome this. Can you dispel some of the myths and beliefs that people have towards homeless people, especially at a time like this? You've worked with them, you know them personally. I saw one of the gentlemen there that was greeting you with a smile, and it's clear that you have a connection with them. How can people change their mindset, especially at a time like this, to how they view them and how they can assist once the storm has settled?
Absolutely. Every single homeless person here is somebody's son or daughter, somebody's brother or sister. It could be your son or daughter or brother or sister or cousin. So homeless people are human beings. They're people, they're citizens of South Africa. Here's an idea. Go to the Dennis Hurley Centre website and you will read 10 beautiful stories about real homeless people, about their lives, about their struggles and about their hopes. And I guarantee as you read those stories, you'll think, that could have been me. And that's what we need to do when we look at a homeless person, think, it could have been me. So just treat people the way you'd wish to be treated yourself.
Thank you very much, Dave, for your time and good luck with the program. We've been speaking here to Raymond Perrier from the Dennis Hurley Centre.
Well, Mawande, I'm just curious. I mean, I'm looking at the queues behind you, as we saw in Alex as well. Definitely everybody sort of, neck on neck there. Everybody sort of crammed up together. Is anybody there trying to advise them or telling them exactly what the rules are at the moment? Have you seen any sign of that?
Well, I have seen quite a number of police officers here just trying to control the crowd in terms of how they should move and so forth. But in terms of that social distancing, not so much. And let me just come out of the shot. When you look at it, it would be something that would be very difficult to institutes in this area. The line goes up to a robot which is down the road and there are vehicles that are moving there, so the line would probably be 4 or 5 times longer than what it is, and I understand that is at least 700 people here and more may be expected. But in terms of that social distancing, it isn't really being used per se, but I have been seeing police officers just trying to control the crowds.
All right, well, we'll leave it there for now, Mawande, and I think maybe you should go break the news to those in the queue that we've had 2 deaths, and maybe everybody will actually start to take this a little more seriously, because 21 days will then become the minimum that we will be on lockdown for if we don't adhere to the rules. Let's remind you that this lockdown could continue for weeks, maybe even months, and then think of the devastation we'll suffer as a country from that.